Let's talk about the renal medullary carcinoma to our individuals that are watching the show right now.
Well, renal medullary carcinoma, and we refer to it as RMC for short, easier for everybody to pronounce, is an aggressive kidney cancer that's rare, and unfortunately it afflicts people in the prime of their life, young individuals in their 20s, 30s. We've seen patients as young as 9 years of age, and we've seen people in their teens develop this. And I've seen as old as 47 people in their 40s having that. And it can strike without really any warning signs. Occasionally, by the time the patient goes to the emergency room or goes to the doctor to be checked, they have this kidney mass. And most of the time, in 3/4 of the patients, the mass is in the right kidney for reasons that we really don't fully understand. But by the time they are diagnosed with this cancer, it in 95% of the patients has spread outside the kidney. And I think it is important for people in the community to know that when an individual who is of African descent has a mass in the kidney, I think the first thing that should come to their mind is, could this be this RMC? And I think if the individual does not know, has not been checked, whether they have sickle cell trait or not, they need to go and be checked. But most people, by the time they're adults, or at least teenagers, they've been already told or they've been tested for sickle cell trait. And as you mentioned earlier, at hospitals now, newborns are tested for sickle cell trait. So I think if a patient has sickle cell trait and is told by their physician that they have a mass in the kidney, I think they need to remind themselves and their families and their treating physician, could I have this renal medullary carcinoma? Because I think it is important to know if this is what it is or not. Because how you approach the treatment, what you do for the patient, I think could be crucial. And at MD Anderson, we have launched a program to study this disease. We have made it our focus. I personally have made it my focus to study this disease, to find targets for this disease that we can go after. We are on a campaign to identify, to discover what really causes this disease, what makes it aggressive, how does it progress, why does it respond to some treatments and others, and we're